Just last week, I was treating a 55-year-old patient whom we call a frequent flyer in dental world. Someone who's in and out of the dental practice, spending hundreds and thousands of dollars and been through excruciating pain. At the end of this appointment, she mentioned to me, "Doc, wish I could turn back the clock and do something when I was younger." That really stuck with me, and because this is a common regret I hear from most of my patients. That made me thinking, what if I could help you avoid all of this? So, I decided to give out 5 little dental secrets that can save you hundreds and thousands of dollars and prevent these dental cavities. And trust me, you wish you had known these earlier. Let's dive into secret number 1, the gentle art of brushing. When you're brushing, you're not enacting a fight sequence in an action movie with your brush. It's a gentle art form with finesse. Why does it matter? It matters because when you brush too hard, it's like scrubbing a pot which is burnt. You're gonna wear down that enamel, the outer layer of the teeth, and expose the softer layer that is dentine, which is more susceptible to cavities. It can also recede the gums away, making you more sensitive around your teeth and creating other cascades of problems, which includes gums and bone disease. Now, how do you take care of this? Guys, it doesn't matter if you are an electric toothbrush user or a manual brush user. Use a soft bristled toothbrush. Hold it at a 45-degree angle to the tooth and make circular gentle movements around the teeth. Also remember guys, you're not imagining while you're brushing. You are gonna watch yourself in the mirror while brushing, moving from one surface to the other and to the third one. Now, pro tip, right after brushing, do not rinse out immediately. Let the fluoride in the toothpaste stick to your teeth for at least 30 minutes. Now let's move on to secret number 2, the timing trick. What do you mean by timing trick? Guys, when you eat food, your mouth is under acid attack. As we discussed in our previous video, when you eat, the bacteria feed on these carbohydrates, creates acid, drops the pH in your body, in your mouth itself, and creating the problem which leads to cavity. Now, why does it matter? When you brush right after eating, you're gonna wear down the teeth even further away. Now, how do you avoid this? Guys, wait at least 30 minutes after eating anything because you're gonna allow the saliva to neutralize or buffer the acid and bring that pH back to the optimal levels. Pro tip, when I speak about timing, make sure you brush before sleeping. I know this is a broken record by every dentist. The reason is when you eat your dinner, your mouth for the rest of the night, when you sleep, the saliva production goes down. Now we know the saliva is a savior which buffers the acid attack. When it goes down, it's like a ghost town. These bacteria can feed on this food that you have eaten for dinner and can produce more acid. And hence, brushing right before sleeping is very, very important. Let's move on to secret number 3, the floss game. Now, what do I mean by that? I know most of you out there are like, I've heard enough about flossing. I don't like flossing. I can't do flossing. My teeth bleed or my gums bleed when I floss. Guys, why does it matter? When you just brush and not floss, you're just taking away 40% of the teeth which is uncleaned. Right, 40% of the teeth. Imagine, when you wash your car, you just wash the front and the middle section of the car and not the back of the car. Have you seen those cars on the road? I haven't, but if you have, they look probably disgusting. So, how do you do this? Take an 18-inch floss tied between your thumb and your index finger on one hand and probably the middle finger on the other hand. Make a loop and leave a short end to glide between underneath the gums and hugging the tooth in the front and the back. Remember, guys, it's a gentle fashion where you clean the teeth and not a seesaw of where you try to cut through the gums. Now, pro tip, if you are experiencing bleeding right after flossing, there are one of the two things that's happening. Either, as I said, your seesaw, you're cutting through the gums really hard, which you need to speak to your dentist or the hygienist to enact or make sure your technique is right. The other one is because you haven't flossed in a while, your gums are inflamed, and when things are inflamed, it's going to bleed. So don't stop flossing right after if you see bleeding. Floss further, give it a week, and that inflammation is going to go down, and your teeth are going to stop bleeding. Let's move on to secret number 4. Eat smart for your smile. Now, what do I mean by that? Guys, I know a lot of authors on YouTube, on PubMed, everywhere else spoken about intermittent fasting. It helps overall health. You know what it helps? It helps your oral health as well as your dental health, which can prevent cavities. It's most important how frequent you eat. Now, for a personal example, what I do is eat my first meal at between 12 to 1 and maybe have a snack around 4 o'clock or 5 o'clock in the evening, and then have my last meal, the dinner, at around 8 or 9 p.m. I do not frequently snack in between. Now, why does it matter? More you eat, more acid you're going to produce in your mouth, more your teeth are under constant threat from these acids. Intermittent fasting helps overall body keeping in good shape, also keeping your teeth in good health. Let's move on to secret number 5. Saliva, your mouth superhero. Listen, you don't have to pay extra to buy saliva. Your body produces saliva. Now, saliva, as we discussed before, is something that balances, buffers the pH that is produced by the acids in your mouth by the bacteria when you eat. Now, why does it matter? It matters because these acids can cause cavity. Your saliva is going to buffer it down, or let me say, buffer it up to make it more an optimal level so that your teeth are not under constant acid attack. Now, how do you do this? You can aid in improvement of saliva by constantly hydrating yourself, at least 2 to 3 liters of water per day, constantly sipping on water. And another thing, use of xylitol gums. Now, xylitol gums are protective because xylitol, as the name suggests, a little bit of chemistry, sugar and alcohol. The bacteria in your mouth, most of them like Streptococcus mutans, or we call it strep mutans, thinks it's sugar. When it eats, it dies because there's alcohol in it. A little bit of chemistry kills the bacterial cell wall. Now, I'm not saying go ahead, buy those xylitol sugar-free gums and start eating 20 of them at one go. Eat about 2 or 3 in a day, space it out, just eat a little bit and see there'll be production of more saliva, as well as the help of xylitol in these sugar-free gums is going to aid in production of cavity. I'm feeling generous. I'm going to give you a 6th bonus secret, telling you why are you guys being told to brush twice a day. The reason is when you eat something, the bacteria tends to attach to the teeth with what we call biofilm. This biofilm is formed every 12 hours. In a day, we have 24 hours. With 24 hours, every 12 hours, this biofilm is formed. When you brush 2 times a day, you're going to remove in a gentle way the biofilm and hence preventing the cavity. So there you have it, folks. The gentle art of brushing. The timing is important. What you eat and how you eat is important. Your saliva is your savior. Floss is the real boss. And I gave you a bonus tip as to why are you supposed to brush twice a day. If you thought this video was informative and you learned something, please do subscribe and share with your friends and family. For the next video, I am going to tell you how you can remineralize or repair your cavity. Yes, you heard it right. How to repair those cavities. Leave your comments in the comment section below with what you thought was an interesting tip that I gave, or if you have any other thoughts or any other practices that you've been doing that has helped you prevent cavity.